Restoring your range of motion after an injury is one of the most important steps toward full recovery. It's not just about getting movement back. It's about teaching your body to move smoothly, safely, and confidently again. Limited range of motion can lead to stiffness, pain, and even re-injury if left unaddressed, so gentle, consistent effort is key. The first step is to understand that your range of motion, or ROM, is your body's ability to move a joint through its full potential. When you're injured, swelling, muscle tension, or scar tissue can restrict that motion. The goal of recovery is to gradually restore flexibility and control without pushing into pain. Start with passive movement, where the joint is moved with little or no effort on your part. For example, you might use your hands, a strap, or a therapist's assistance to guide the injured area through its natural motion. This helps reduce stiffness and stimulates healing without adding strain. Once your body tolerates passive motion comfortably, move to active assisted movement. Here, you use your muscles lightly to support the motion. Think of this as a partnership. Your muscles help move the joint, but they're not doing all the work yet. As strength and confidence grow, you'll progress to active movement where your muscles take full control. This is where rebuilding coordination and strength begins. Start slow, focus on control, and keep your movements within a pain-free range. A key principle is to move frequently, not forcefully. Short, gentle mobility sessions throughout the day are more effective than one intense session. Movement helps improve blood flow, reduce swelling, and keep tissues elastic. Don't forget about breathing. Deep, steady breaths while moving help relax tight muscles and calm your nervous system, both essential for restoring motion and reducing pain. Stretching and light mobility work can also help, but avoid overstretching early on. It's better to work at 70 to 80% of your comfort level and let flexibility return naturally. Techniques like dynamic stretching, joint circles, or controlled articular rotations can all support ROM improvements. If scar tissue is limiting your movement, gentle myofascial release or massage therapy can help break down adhesions over time. Always work with a professional if you're unsure which techniques are safe for your specific injury. Finally, remember that recovery is a process of patience and progress. Even small improvements in range, a few extra degrees of motion or less stiffness in the morning, are signs that your body is healing and adapting. With consistency, awareness, and care, you can restore your range of motion, rebuild confidence in your body, and move freely again, one smooth motion at a time.